Dominicanos en el Capitolio, en vivo por TV Quisqueya.
Bueno, good afternoon. My name is Catherine Pichardo. I'm president and CEO of Latino Victory. We are a national organization that focuses on building Latino political power. We actually are delighted to see one of our founders here, Henry Muñoz III. So I would like to say thank you. And our chairman of the board, Cristobal Alex, as well. It's an honor to be here with our colleagues in healthcare. We're gathering at a pivotal moment, particularly for the Latino community. Across the country, families are navigating rising healthcare costs, persistent coverage gaps, and policy decisions that directly impact them and their healthcare. For millions of Latinos, Medicare and Medicaid is a lifeline, and they determine whether our seniors can age with dignity, whether children receive preventive care, and whether working families can see a doctor without risking financial hardship. Health equity is not a policy goal. It is a moral imperative. And as someone who worked in government and politics for the better half of the last 20 plus years, I can tell you that's why having the right people in positions where they can make decisions is important. And that's why Latino Victory fights for political representation at every level of government. Accessible and affordable healthcare is foundational to economic stability and the well-being of our communities. So today's conversation is more than programs and regulations. We are really talking about people and about ensuring that the promise of our healthcare system extends to every zip code, every language, and every family. So I am grateful to introduce the panelists today. We have Frances Collado, who is Director of Legal Policy and Strategy and Research at Planned Parenthood. We have Christine Garcia Elliott, Esquire, who is an elder law attorney with Vishick, McGovern, and Milicio LLP. We also have Angela Gonzalez Perez, Vice President of Operations and Executive Director at the Einstein Hospital campus of the Montefiore Healthcare System. Errol Pierre, who's the Chief Growth Officer at Health First. Raven Ryan Solon, who's Chief Compliance and Regulatory Office at Metro Plus Health. And Dr. Paul Talla, Chief Medical Officer at Somos Healthcare. So we'll quickly start. A question for each of you. From your perspective, what is the state of policy across the U.S. healthcare system, and what are the biggest challenges that the Dominican American community is facing as it relates to healthcare? And we'll start with you, Dr. Talla.
Pleasure, but great to be here. I think from my perspective, the biggest issue in policy facing the U.S. health policy is come to one reality. We spend an enormous amount of money on health care, yet we can't reliably buy good health care. And that translates into what was last year, by 2024 actually. We spent $5.3 trillion in health care, about 18% of the GDP, or $15,500 per person. Yet our health care is still suboptimal. I think that's the reason why both parties, whether Republican or Democrat, always come back to this and have to talk about what the right amount of healthcare policy means to not just the Latino community, but more specifically the Dominican community. And when it comes to, the biggest challenge that Dominican immigrants and Dominican Americans are facing, I think it's a very simple thing. When it comes down to it, I think it's about accountability and availability for our population. About 10% or 1 in 10 of Dominicans are uninsured. And that's a great number to have. And I think it's about half of that in New York City, where we deal with that. However, if we break that number down and we come to who's accountable for that 90% of Dominican insurance, it's actually more than half of us are insured with public services, Medicaid, Medicare, CHIP, all these cuts that are vulnerable by the government can drastically affect the insured Dominicans that exist nationwide and in our communities. So I think that's one of the biggest issues that we face.
Thank you. And Angela, tell us a little bit, if you don't mind answering that question as well, because I think from the broad perspective of Montefiore being one of the largest healthcare provider systems in New York, I'm sure you see a lot of patients and in the Dominican community, and you can talk about this issue as well.
No, thank you. Thank you for that question. Can you hear me? Mm-hmm. Okay, great. So I think Paul said it best. We do have great opportunities in how we access healthcare and how do we get to our communities. In New York, in the Bronx, most Dominicans and Dominican Americans rely on public health insurance. At Montefiore, we see about 1 million unique patients a year. Out of that million, 80% of our patients rely either on public insurance or actually come to our doors with no insurance at all. So when we talk about the impact of policy and conversations that are happening right here in Washington, that's the direct impact. What's gonna happen to all of those people who rely on us, on healthcare systems, healthcare insurance companies to get access to care when decisions are being made without thinking about that impact. And I think when I saw that question, I also thought about the responsibility that we have as a nation, the responsibility we have as hospitals to provide that care, regardless if someone has insurance. So the burden ultimately will go back to hospitals. So when people can't pay for health care or they don't have health insurance, access and care is delayed. So what happens? We end up seeing people that are sicker, that have waited too long to take care of themselves, and it actually costs us more money to take care of them because we want people to be better. But if we don't invest at the right time to the right communities, we do face some dire consequences in healthcare. So I'm glad that you asked that question.
Thank you. And for the people in the back, please give us a little respect for our speakers. If you can take your conversations outside, we appreciate it. Christine, please tell us a little bit about this question on the impact of our current healthcare system, specifically as it relates to the Dominican community, and in your case, as an elder law attorney, for seniors.
So often I meet clients when it's already too late and they're in crisis mode, right? And at that point, we're scrambling to figure out what can we do to assist you where you are now, right? So not only are we sometimes coordinating with doctors, home care providers, any community organization that has the capacity to also provide maybe respite care or something else to assist those individuals. And a big part of it, right, one of the things that I see is the challenge with Medicaid, right? The moment you start cutting services or access to Medicaid or making it harder for people to get Medicaid, jump through hoops even when they actually qualify, it really is a significant impact because it delays the care that they can receive. So often, you know, the hospital may be saying they're ready for discharge, but it's not a safe discharge because they don't have the appropriate care at home. And we can't get the care at home because we're waiting for the Department of Social Services to approve an application that truly should have been processed weeks ago. And even once it's processed, we still need to go through an entire process to get assessments done and care in place. During this time, the individual, if the family decided we're going to bring them home because there was different pressures, they decline. They end up back in the emergency room. They end up needing surgery. They end up in nursing homes. Or maybe the caretaker child had to step out and run an errand. Now they fell at home and maybe they passed away. These are all preventable if we have the care in place at the right time. So we need to develop policies that really take people into consideration and how this affects us in our households.
Thank you for that. And there's a lot, of course, that we can talk about as it relates to women's health. But Francis, from the perspective of Planned Parenthood, can you tell us a little bit about the issues that Dominicans are facing as it relates to our healthcare system?
Of course, and first of all, I want to state a value statement saying que todas las personas, sin importar sus ingresos, su raza, su estatus migratorio, merecen poder accesar la salud y que sea accesible y que la puedan pagar. But the U.S. But sadly, the U.S. healthcare system has been for decades long a broken system, and over the past year, we have faced unprecedented attacks to push affordable care further from the reach of millions. And Planned Parenthood is a perfect example of this, since the beautiful bill, which I will refer here as the HR1 law, o el HR1, que fue firmado por Trump el 4 de julio del 2025 del año pasado, attempted to defund Planned Parenthood. And what we are seeing here is definitely a deliberate policy choice at the federal level that makes care just more expensive for Latino communities, and this includes Dominican immigrants and Dominican Americans. Here, what this HR1 law was denying people with Medicaid from using their insurance at their Planned Parenthood health center. And this has already impacted hundreds of thousands of patients. This law has also slashed healthcare coverage for immigrants, including lawfully present residents, mixed status families. It makes ICE the largest law enforcement agency of the United States, while at the same time cutting Medicaid, and also cutting CHIP, the Children's Health Insurance Program, and also cutting the Affordable Care Act, or the ACA, premium tax credits. And that is not accidental. So when you pair these cuts with the Trump's Department of Homeland Security rescission of the sensitive locations policy, which it is a policy that historically have kept immigration enforcement away from clinics, schools, and places of worship, you create a chilling effect. And people just don't stop needing care, they stop seeking care. We know exactly what that looks like. People skip birth control refills, delay prenatal care, avoid STI testing, delay time-sensitive abortion care, and for Dominican families, this shows up then as impossible choices. Se van a preguntar, ¿qué hago? ¿Salgo a buscar acceso a la clínica? O si lo hago, me voy a encontrar con algún oficial de inmigración en el proceso o en la sala de espera. Se van a preguntar, ¿qué hago? ¿Voy a renovar mi plan de salud? O si lo hago, voy a poner en riesgo revelar la información de mi estatus migratorio. Son algunas de las preguntas que seguramente están pasando muchas de las familias dominicanas en estos momentos. Así que the state of policy right now is one where fear is being intentionally induced, coverage is being stripped, and healthcare access is being treated as optional instead of as a basic human right.
Thank you. Thank you for sharing that. And Errol, we've been talking about insurance, right? Insurance keeps coming up in every healthcare conversation. So from the perspective of your position at Health First, can you share with us a little bit of some of the issues that we're seeing in our community?
Absolutely, and thanks for having me. Happy to be here. So Health First enrolls 2 million people. Over 20% are Dominican and live in Washington Heights or the Bronx, and they're going to Montefiore, or they're seeing community doctors like Paul Talage, or they're signing up at Metro Plus or Health First. And so for us, when we think about the things that keep us up at night from a policy perspective, from HR 1, which was talked about, it's also called One Big Beautiful Bill, there's 3 main things that we fear. The first one is there's federal funding that will stop for certain immigrant populations, specifically DACA recipients, refugees, asylum seekers, and people who are here in the country because of TPS. As you know, TPS almost expired for thousands of Haitians, so this is a big impact for many people, including Dominicans. So that's the first piece. Even though the federal government might cut that funding, New York State will still fund it. However, that means it's state tax money. So state taxpayers, middle class New Yorkers are funding something that used to be covered by the federal government. So that's a big issue. The second one is something called work requirements. And it's an expectation that everyone who's 19 to 64 should be working to get access to Medicaid. Now, it's a mythology that they're not working. All the Dominicans I know that have a Health First insurance card, 95% of them, they're working already. And so to have them go through a process to prove that they're working is a hurdle that might jeopardize their insurance. And if they fall off, then they can't go to the doctor. They can't go to Montefiore to see their hospital. So it seems like an unnecessary burden that they're gonna have to go through twice a year to prove that they can stay on Medicaid insurance. And then the last piece is funding. And so naturally, we essentially have a 2-tier system because Medicaid rates are much lower than commercial rates. So if you have private insurance and you get your coverage from a private insurance plan, the physician sees you for the same procedure and you get paid more. A Medicaid rate is lower, that's governed by the state, it's governed by the federal government, and so those providers that take care of predominantly Medicaid patients are getting paid lower money for the same exact service. And so what that creates is a Dominican person who has Medicaid in Washington Heights calls for a specialist visit. To no fault of their own, the specialist will say, I'll see you in 6 months. Someone who has commercial insurance with private insurance calls the same specialist and they say, oh, a seat just opened up, I'll see you tomorrow. So we believe you can't have health equity without payment equity. The rates have to change so that the doctors can get paid adequately for what they see. Montefiore sees thousands and thousands of Medicaid patients. The Bronx is the lowest income county in the country. And so how can Montefiore pay its bills if it's getting so much of its revenue from Medicaid? So we have to fix this. So when you add the immigration issue, the fact that there's going to be work requirements for a swath of the population every 2 months, twice a year, every 6 months, and the fact that there's payment inequities and how doctors get paid, it's a recipe for disaster.
Absolutely. And Raven, you're Metro Plus, so I'm sure you experience a lot of what was just said. But also I'd like to know specifically, how are the health plans helping Dominicans or Latinos as it relates also to language and those who have limited English proficiency?
So I think, well, first of all, I'm the Chief Regulatory Officer, and I am a super nerd. Regulations get me out of bed in the morning. I love them. But one of the key things is regulations in the US originally came about to help people, to give you a safer working environment, to give you access to care. And they're currently being weaponized against people. But specifically in the language space, what we've seen over the last couple of iterations of this administration is regulations being removed. Well, you no longer are required to ensure that someone gets a notice in their language, that you're meeting these requirements. You don't have to take these additional steps. The regulatory requirement goes away. the critical thing that we at Metro Plus, and I know our colleagues at Health First do, is ensure that we don't change those parameters. We know that translation services, access to materials in your language is critical. And so we don't let a lessening of obligation from a rules standpoint change what we see as our obligation as individuals who serve our community. And one of the most critical things on the language front is that I think it's pretty obvious to people that culture impacts how someone experiences the world. But recent research has also demonstrated that your language impacts how you experience the world. How you will not just intellectually understand what your doctor is telling you or other scenarios, but actually how you absorb them, how you engage with them. And so making sure that we not only know the language, meaning the technical grammatical framework of another person's language, but how that changes how they might interact, what they need to hear, how they need to be engaged with, and we train our staff on that. And another thing is that we, as an organization, strive to be as diverse as the communities we serve. You can, yes, get access to translation services from a professional, but you're gonna reach someone who can speak multiple languages in our call center because New York City has so many languages as part of its standard population. And so it's always keeping the goal in mind of being there for your community, being a part of that community, and language is a critical way to do that.
Thank you. And so we've explored a little bit of some of the challenges and what we're dealing with today. Dr. Taya, what policy changes do you think would most improve community health for Dominican Americans and our communities?
Let me see. If I could choose something from a short list, it would be policy that makes prevention financeable and coverage stable. But what I mean by that is, first, we should protect that stable and affordable coverage by preserving Medicaid and CHIP eligibility. Those are very important for our community. And reducing administrative barriers that can cause members to disenroll and get lost to the system. I would say defend payment models such as value-based care that can help pay for prevention and community-based interventions without reducing any healthcare inequality that can occur in the community. Value-based care can effectively fund what fee-for-service does not fund, and at the same time promote that quality that we all look for in healthcare. And then I think the third thing that SOMOS really does well is provide culturally competent, language-coordinate care that matches the community. You know, more than, I think, more than half our community is not English proficient. So when we go to the doctor, you know, it should not just be optional to have an interpreter. An interpreter should be something that can be afforded to the member, as well as something that can be reimbursable at the end of the line and not be detrimental to the health care of that member. I think those are the things that I would address more if I could just cut the chase.
Angela, would you agree with that? Is there anything that you would add? And also, what do you think are the greatest achievements in terms of healthcare that we've accomplished recently that we should perhaps continue to build upon?
No, thank you for that, Catherine. You know, the Dominican American community is thriving, and we saw it here. We saw it here in this room with the massive amounts of professionals in many settings, and that's a great thing. And I think the power of our people has demanded that we pay attention to our community, and I've seen it in healthcare. So it's no mystery that we have really great, successful public insurance companies in the marketplace. You know, I have Health First and Metro Plus here. Emblem Health is also here, and they're in the community. And that's been a wonderful achievement. When I see our partners in insurance at our hospitals, in community affairs, in community events, enrolling our people in their language, that's an amazing achievement, and we have to celebrate that. We also have to celebrate the fact that organizations like Montefiore are investing in culturally competent care. That happened because we demanded it. We said we needed it as a community. So we're seeing more and more of us in healthcare settings, speaking our language, making sure that people feel comfortable with us in healthcare. And that happened because we spoke up, but we also wanted to make sure that we went to school. So, you know, Baruch left already. I graduated from Baruch, and yay. And it was really important for me to see people like me, you know, Dominican-born, raised in New York, getting a profession, because I knew that I could use my voice to help our people. And that's a great achievement that we're seeing. And I'm glad you asked that question, because we do have to stop and celebrate the progress that we've made. You see more community-based care, you see more people in the community treating the community, so we have to work hard to keep that. And if we lose it because of, you know, impending cuts, the targeted cuts that are out there at the federal government, that's what we're gonna lose. We're gonna roll back all that great progress that we've made because of decisions that are being made by people who don't know our community. And that's something that we have to contend with.
Thank you. So, looking forward, and the same question around what should be our policy priorities. Francis, what types of policies should we be supporting to address the issues of pregnancy and prenatal care, as well as postpartum, especially mental health, and addressing any other concerns?
So I would like to say that we definitely must support policies that invest in reproductive health care. And that means expanding coverage. So specifically, it means restoring and expanding Medicaid and ACH coverage, including for immigrants, reinstating ACA marketplace access for DACA recipients, protecting and funding Planned Parenthood as an essential safety net infrastructure, and ending policies that weaponize abortion, gender-affirming care, and immigration status rhetoric to cut insurance and to deny care. Also, investing in comprehensive prenatal, postpartum, and mental health services, not only in surveillance or punishment policies.
Thank you. Christine, what do we need to do for seniors?
A lot. But I think one of the things that, as was spoken about, right, one of the things that I believe are successful, I'm born and raised in the Bronx, and I'm seeing a lot of community centers opening up that are sort of becoming information hubs, right? So connecting individuals not only with the resources they need to maybe get meals at home or get some home care, but maybe someone comes in for, you know, your typical bingo activity and the staff sees that they're not doing well, and now we can get you to a medical provider to address your needs. So I think that's a great thing that has, I think there's organizations that are pushing more of that, and I think that's very important. But one of the things for me, from an elder law perspective, that I really believe in is that this is interrelated, right? The solution is not just health, it's legal. Because oftentimes, as health declines, the legal challenges begin. What happens when someone gets denied for Medicaid? Now we need to have a fair hearing. What happens when they had a surgery, now they're unconscious and they can't make decisions? Do they have a healthcare proxy? Was there a power of attorney done? Maybe mom owns a house. They work their entire lives to save for that one family home that now needs to be sold to pay for care because there was no Medicaid planning done. So there's many tools, and a lot of that is just misconceptions because they're hearing that they don't qualify because they own this house. That's not true. It's all about planning. And when there's lack of access to legal services and information, then the whole family suffers because you're really tapping. Now if the house has to be sold, the other family members who were living in the houses have to move. All the income is going to pay for, all the assets from the home are gonna go pay for care. So I really think that we need to work with, whether it's not-for-profit organizations or attorneys that do service the community and are part of these organizations, to bring additional information to the community. So not only are we connecting patients, right, to healthcare and home care and meals, but we're also providing them legal resources to empower themselves, to advocate for themselves, or to have someone advocate for them. And a big part of that is having advocacy in your language. I often get appointed as guardian for individuals that don't have capacity. And during the investigation, sometimes the court is told that this person can't take care of themselves. The household is a mess. These, things are happening. And when I walk into the household, I just see a traditional Latino household. I don't see anything wrong. And I have to go back to court and say, no, this is a problem because this is how our people live. And I think policies and solutions need to address how our community and our culture sees things, not others.
Thank you so much for sharing that. And you mentioned community-based organizations who are important partners for our healthcare infrastructure. Errol, are there community-based organizations, faith-based groups, or informal networks that have been, in your experience, particularly effective?
100%. They were here today. So Frankie Miranda from Hispanic Federation, they are a conglomerate of nonprofits that come together that we work with very closely. Somos is in the house, Dr. Talaj, Paul Talaj. They are running the SCN in the Bronx, which is giving money to community-based organizations to screen people for social determinants of health. So if you need food, transportation, anything, they are in charge of that whole process in the Bronx. All of those community-based organizations reach people better than Health First or Metro Plus ever could, because they're in the community, they're at the bodega, they're at the beauty salon, and they can meet the member where they are. When the member comes to the doctor's office, if they get screened right there, then they don't have to go someplace else. And so they're getting healthcare, a prescription, and food at the same time. So we work very, very closely with community-based organizations. We wouldn't be successful without them. There are eyes and ears. They tell us when ICE is on the block. They tell us when the abuela on the 5th floor hasn't left the apartment in 2 days. We wouldn't be able to exist without connection to them.
Thank you. And Raven, what systemic changes or training initiatives can health plans, health organizations, in your opinion, implement to strengthen the quality of provider-patient interactions, particularly for culturally and linguistically diverse populations, as we've been discussing? Certainly our community groups are doing their part. Many of the healthcare organizations here are doing their parts. You're a systems person. Systemically, what do we need to change to try to get to a better place as it relates to U.S. healthcare and specifically for the Dominican community?
Well, there's a couple things that come immediately to mind. I think one of the biggest is we need to build on a transformation that has thankfully been taking place across U.S. healthcare over the last decade or so, which is, when I first started out a couple decades ago now in the legal field, the attitude was we treat everyone exactly the same. all the time. And it's a beautiful sentiment, but it's not real because every person is coming to you with unique experiences, unique culture, and we have been slowly moving away from that idea as we talk about culturally competent care and language, but we need to continue to build on that and enhance that even further. I think the example that you gave of putting into policy or regulation or law things that simply don't align across a variety of cultures is really, really critical. And large systemically, again, coming back to regulations, because they are my bread and butter, we have created a stunningly complex regulatory environment. I have a favorite saying, so favorite that a colleague put it on a mug for me this past Christmas, which is, you can fly a plane with less regulation than offering health insurance in New York State. And I mean that. It's only slightly hyperbolic. And that needs to be attacked head on. While I am proud to know as much as I do, I shouldn't have to know 200,000 regulations to help ensure that people get access to the care that should be a human right across the board for everyone. We're too complicated. At a smaller level, again, enhancing and putting further emphasis on that cultural awareness training, making sure that it's a part of your training when your staff come on board, whether they're at a health plan or at a provider. It's part of your annual training every time. You're focusing on it, paying attention to what you need to update as the world changes around you and what those obligations are. And then as Errol was mentioning about being in the community, when you're in the community, it's not enough just to be there. You have to know those communities and learn from those communities. Be forever iterative in how we engage.
Thank you. Appreciate that. So we're coming to the end over here because we are running out of time. So I will ask all of the panelists to please be brief. And it's the same question. What gives you the most hope for the future of health in the Dominican community? And we start with you, Dr. Taya.
I like this question. So what gives me the most hope is that the Dominican story shows that policy can work. And what I mean by that is that when policy expands access, communities are going to use it and health is going to improve. You know, the fact that the NYC uninsured rate is half the national average at, I think, 5.4%, and that 84% of Dominicans report having a PCP means that Dominicans believe in healthcare and want better healthcare. And when we pair that trusted primary care with value-based resources, such as what we employ at Somos, the care teams, the community partnerships, the culturally aligned prevention care, the path is clear. When you provide access to quality health care and you invest in that health care, the outcomes are going to show at the end of the day, and those outcomes at the level of a policymaker is going to allow more room to put funding in the right place where it needs to be and not let it go to waste. What I did want to mention one thing about one of the other prior questions about what I think we need to change, something that I do think is very important, is that researchers begin to disaggregate the data that kind of puts Latinos in like this one big group. I'm not saying that we're not like our fellow Cubans and Colombians and Puerto Ricans. We suffer the same things, at least clinically in many elements, but we are Dominicans, and we should have that subgroup clearly labeled in whatever we have to fill out, because that way we can actually determine what the risks are to our community and then invest in the things that actually reflect directly towards us.
Thank you.
I think what gives me hope is a room filled like this, and also we know it works. So when the pandemic hit, there was policy at the federal level that said no one can get kicked off their Medicaid insurance. And we did that for 3 years. And for 3 years, people didn't have to recertify for Medicaid. And Medicaid grew. And people had access, and they were able to go to their doctors, and they never lost their insurance. So we know what works. We did it. New York State created a program called Essential Plan. It was created because people who make $1 too much for Medicaid can't afford commercial. So they created this nice little plan right in the middle where if you make too much money, you don't lose your insurance and you can still get something affordable. We know it works. Now it's under threat, but we know it worked. And it worked well, and we should keep it. In New York, we incentivize health plans, hospitals, providers for quality. The better quality you have, meaning women who are over 40 get their mammogram, men over 60 get the colonoscopy. If you do that, it rewards you financially. And so doctors learn to take care of their patients proactively. We know quality works, so we have to continue it. So what gives me hope is we know the answers. It's just us actually making it happen at the policy level. But it's not we're not missing the answers. We know the answers. It's just how do we get them to actually happen.
No, thank you for that. And Paul took a little bit of my thought. I think, what gives me hope is that more and more people are insured. And, to see that number that only, 5.4% of Dominicans are uninsured, which reduced significantly year over year, that's amazing progress. So it gives me hope that our community understands and values the importance of healthcare. We have to take care of ourselves. What also gives me hope is that organizations understand the Dominican community more and more. At Montefiore, because I have to put a plug in for Montefiore, we created a direct partnership with the Dominican Republic. So we have a medical agreement with Sedimat directly in Santo Domingo for cardiovascular care and soon oncology care, which means that people living in Dominican Republic will be able to get top-level care by Montefiore physicians. And we're also going to partner with Sedimat to train Dominican doctors. And we're going to have tumor boards across the board. That's the power of partnership. So those things give me hope. I just started at Montefiore, but one of the things that really gave me a lot of pride was learning about a clinical trial that was targeted for Dominican Americans. Learning about how we can prevent cardiovascular disease in Dominicans. That's progress. So when we look at data and we're lumped into being a Latino or being Hispanic, that is problematic because we're so different. We come in so many different shades. We come from so many different backgrounds. So to have a clinical research specifically for Dominican Americans, that gives me hope. That means we're going to find targeted interventions specifically for our community. So that's because we did it, because we have sessions like this. So people know the power of our voice, the power of our advocacy. So let's continue this. This is not just one day or a 2-day event. That's what's gonna make the difference, and that's what gives me hope.
Thank you. Francis?
So I definitely want to echo the words that already have been said, and I will add that in terms of hope, definitely that organizations such as Planned Parenthood are still providing care to thousands of Latinos, and that includes more than 500,000 Latinos, incluyendo Dominicanos, before 2025, is definitely a huge number in spite of all the policies that we have talked here that are attacking the access to healthcare, particularly to immigrant and Latino communities. So I will end in terms of saying that Latino communities, including Dominicans, give me hope porque se mantienen organizados y organizadas, resilientes, y como tengo que decir y tengo que mencionar a Bad Bunny, soy puertorriqueña, así que decir seguimos aquí. Y es una frase con la que creo que también hay mucha conexión con la comunidad dominicana. Seguimos existiendo, seguimos también luchando por más acceso a la salud, por seguridad y por la dignidad de todos y todas.
Gracias.
Two things. One, that people care. I know that the news can make it seem that maybe they don't, but when you're actually out in the world experiencing other individuals, they care. They care about their neighbors. They care about their family. They care about strangers. And that's what makes a community. And that gives me a ton of hope. And the second thing is, as we've heard repeatedly today, the Dominican community are people who stand up for themselves. They are proud of who they are and willing to step into the fray and say, this is what Dominicans need. And anytime people are willing to stand up for themselves, that always gives me hope, because that's what moves change. And we need people continually 10 toes down, standing firm on what is required. And we're seeing that out there in the world.
You took my sentiments entirely. As an advocate, I think what gives me hope is that we are having these conversations, and that, you know, I'm thankful to have been invited to speak, because I think there's some recognition that this is an interrelated issue that needs to be resolved in tandem for a holistic approach. So I think what gives me hope is that we're having the conversations, that we're not staying quiet, that we're pushing back, and we're organizing. We're making sure that our voices are heard, and that's what I really want to see continue.
Thank you. And I would argue that what gives me hope is to have amazing leaders like all of those here on this stage who are fighting the good fight. Así que seguimos en la lucha. Y gracias a todos ustedes por compartir con nosotros esta tarde. La verdad es que es un tema muy amplio que no podemos cubrir en un solo panel, pero estamos trabajando arduamente. Quiero agradecer a Cristina Contreras y a Rodolfo Pu, que son copresidentes de la Dominicans on the Hill presentación. Y bueno, a todos los compañeros y colegas que están aquí esta noche. Muchas gracias y sigan disfrutando.
Dominicanos en el Capitolio, en vivo por TV Quisqueya.